All right, everybody. So what's today? The 8th, Thursday, week 1, day 3, live and direct. So you guys want this on YouTube later on? That way you guys can catch up if you need to. All right, so last time we talked about rights and responsibility. Somebody tell me one responsibility of the patient. One patient responsibility we covered on Tuesday.
Keep your appointment.
Yeah, there you go. Make sure you're on time, keep your appointments. What's another responsibility of the patient? Yeah, following directions.
Any information.
Yeah, don't hide any information. And what else? Yeah, mess with Dang and make some money, right? So make sure they pay as well. All right, we talked about enteral routes. What are the 4 enteral routes?
Sublingual, buccal, and PR.
All right, so good. So that means our 4 enteral routes are PO, SL, BUC, PR. Everything else is going to be parental. So we'll get into more parental routes and we'll finish up drug administration. For next week, we're going to cover calculations. But you guys are already familiar, right? Everyone's taking a pharmacy course. So make sure you do the DCs and reference the material. There's going to be PowerPoints and videos available for you.
So if you haven't taken the pharmacy course, how do you do?
This is a beginner course, so the math is basic. So for everyone who has taken a pharmacy course, there should be no excuses. Line up. I'll get to kick you in the butt. All right. Since you're the only one that's new, I can't. You're immune. Yeah, I can't kick you in the butt for the math part.
Me too.
No, what do you talk about? All right. Oh, we're supposed to answer these questions. All right. Why is it important to be able to administer medication by a variety of methods?
Because some patients cannot have it in a certain way.
You the MA. Why is it important for you, the MA, to know different routes, how to administer them?
Because the patient needs his, she medication. Not all medications are administered. That medication needs to be given. You have to know different methods because not all medications are administered the same.
But why? Why do I need to go? Okay. What part of my job?
To give the medicine.
Because the doctor might say, give them their first suppository. All right. Somebody in here volunteer and explain to a patient how to administer a suppository. Anybody? Any takers?
So lay on your side.
We went over this.
Yeah, 100 times.
Yeah, we went over this every class 2-3 times. You guys laugh at me all the time.
Lay on your side.
No, it's like, yeah, you want to.
Just one person, one volunteer. I just need one volunteer. Raise your hand if you want to volunteer. Raise your hand if you want to volunteer. Just one person. All right, sir. Go ahead, sir.
Since you wanted to, go ahead.
Ma'am.
All right, so, Miss Jane, today we're going to be administrating a suppository.
It's Tavern.
Yes.
What's that?
It's something that is going to help you out, okay?
Well, everything can help me out.
Well,
What's
not
that?
this stuff. So, this suppository is for the medication. I need something that's just going to go straight to the
Where the
bloodstream.
doctor?
So, first thing I'm going to ask you to do is lay on your side. Lay on your right side. You got to bring up your left knee. Bring your left knee up towards your chest.
That's not gonna happen.
As far as you can, ma'am.
It is.
Now, they're assisting you as well, right? Are they,
You want me to-
so,
you want me to-
All right. We'll cover the details later on, but the point is, the doctor might ask you to administer the first dose, or the patient may, how do I use this? And you gotta let the patient know. For a suppository, you gotta unwrap that stuff first. All right. Why is absorption faster when drugs are administered sublingually or buccally,
It goes directly to the bloodstream.
Temperature.
as opposed to orally, PO? So
when you orally do it,
so it's quicker, directly. Just like chewing tobacco, it'll go straight into the GI tract. All right, let's get into the new stuff. Well, a little review from yesterday. So intradermal, what is the angle of insertion? Yeah, so this angle here that's created, about 5 to 15 degrees. Celsius or Fahrenheit? Okay, you guys are listening. So what layer do we want to give it into? The epidermis. Oh yeah, the dermis. So in between the epi and the derm. So is there any blood here?
No.
No. So absorption is fast or slow?
slow.
Super, super slow. All right, and then we have subcut, SQ, sub-Q. That's going to be under the skin. So what is for subcutaneous? 45 degrees. Bevel up or bevel down? Bevel up. And where are we injecting into? The fatty layer. A lot of blood or no blood?
No.
Absorption fast or slow?
Slow.
Yeah, it's going to be a lot slower. All right, IM. What's the angle here?
90.
90. So that's a right angle. And we're going into what layer?
Muscle.
Is there a lot of blood there?
Yeah.
So what's the absorption rate?
Fast.
Relatively quicker. All right, very good, very good. So IM, a lot faster because of that blood absorption. And you can actually use a larger volume. So in the fat layer, under the skin, probably no more than 1 ml. In the muscles, up to 5, if the muscle's large enough. If it's a baby, newborn baby, which muscle would you inject?
Leg.
Which muscle? Which muscle of the leg?
Muscle.
Thigh muscle. So the vatus lateralis. So in a moment, I'm going to ask you guys to partner up, find landmarks on your body. You guys all taking anatomy, physiology? Okay, good. So you'll use that today to find the landmarks on the body and the injection sites for week 3 and week 4.
Are we doing interviews?
Yes, we are. Z-track. Because the needle is cutting a hole through your tissue layer, you're making a hole where the drug can just leak back out. And for some drugs, it might be irritating to the upper layers if it does leak out. Or if it's an iron supplement, it's going to stain the skin if it leaks out. So what we'll do is we'll pull the layer of skins. So we'll offset the layer of skin. We'll drill our hole. But when we take the needle out, we let go of the skin pops back, and the holes are not aligned. So the drug doesn't leak out of the body. So we'll do that in week 4 to the vatus lateralis. And if you guys want, you can administer it to yourself. So you can practice that one on yourself as well.
Are you kidding me? I'm still stressing the fact that somebody else is doing
You can do it. You can do it. All right, partner up. We're going to find the 3 injection sites for week 3 and week 4. So everyone partner up. Come together. Well, who's your partner? Okay, get together. All right, we'll do the first one, which is
I know.
the deltoid muscle. Everybody palpate for the acromion process of the scapula. What is the scapula? Your shoulder blade. Scapula looks like a spatula, right? So the acromion process is this pointy thing right here at the edge of your shoulder. All right, find the acromion process on your partner. Partner up. All right. So you're going to have to find it on bodies with no cushion, and then try to find it on bodies with a lot of cushion. Find the acromion process.
Sorry.
You are going to go 3 finger widths below the acromion process, and then get your pen, hold it like a dart, and stab it where you think your site is. 3 finger widths down from the acromion process.
I just want to make sure I got it right.
You want to feel this way.
You say 3 inches?
3 finger widths. And then show me with your pen where you're going to stick them.
You're gonna have to lift it because I can't.
Where's your partner? You gotta find it on people with cushion too. Find it on people with no cushion. All right, try to find it on bodies with cushion, some bodies without cushion.
You have to use your pen.
That's fine. You can use your finger. So you're gonna do this. Yeah, all the way in. 1 inch, all the way in. All right.
I was going to ask you with that. Do you have to go all the way to the base?
All the way in. Needles are now all the way in.
Is this a pass or fail thing?
No, it's you need to get a passing rate to pass. You can do it. You got to do lab. What's your question? You want to be in the center of the muscle. So here's the muscle, the triangular muscle. All right, take a look at the thigh. All right, you're going to divide the thigh into thirds. Right? 3 portions this way, and then you're going to divide the thigh again in third this way. It's going to be the outer third. So again, with your pen, find the injection site, and let me know where it's at. All right, deltoid 3 finger widths down from the acromion process. There's your injection site. For the vatus lateralis, you're going to divide the thigh into thirds this way, and then again thirds this way, and it's going to be the outer third. A little bit lower. Yeah, that works. Towards the
That muscle, bam, right here. Yeah, look right there.
All right, that's the easiest one. All right, the vatus lateralis is the easiest one. All right, guys, let's go quiet down a little bit. Let's go to the most difficult one. All right, attention, please. All right, the ventral gluteal. So which hip is on the display right there, left or right? Okay, which hand is on display right there? Left. All right, so you got to use the opposite. So what you're going to do is put the heel of the palm on the greater trochanter of the femur. Mr. Dang, what the hell you talk about? That bone right there, that is the greater trochanter. So you put the heel of your hand on the greater trochanter. Yeah. Yeah, you got to do a partner. You got to partner up. You're going to feel for the iliac crest with your index finger. This guy right here. Spread your index finger and middle finger. And your injection site is right there in the center. So partner up. Opposite hand on the hip. You're going to have to practice people with cushion and people without cushion.
You're poking me really hard.
That's the cushion part.
No, that's not the cushion part. I have a problem with people poking me.
You got to be gentle.
No, I have this problem when I go to the doctor. They be like, why does it hurt? I don't know, but I'm telling you it does. Right here? I want it pointy, sticky part hurt.
So right here.
I don't know about that. It seems like a weird spot to give an injection.
Well, I'm trying to see where you're.
Oh, no, 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 no.
I'm gonna say that right there.
No. All right, guys, sit back down. We'll practice this one a lot more in lab. All right, sit back down, guys. We'll practice this one a lot more. All right. So now you guys know the importance of anatomy and physiology. Oh yeah, that one is the gluteus maximus. We don't do that one because of the proximity, to the sciatic nerve. So we want to avoid the nerves as much as possible. Now, we may hit a vein or two or three. So don't be afraid of a little blood. It's going to be normal.
So on the one on the side right there, you're not spreading the skin, but you're just finding a location and then you're spreading.
Yes, very good. The hand placement is only to find the injection site. That is not the technique. We'll go over the technique more in lab.
So those are the three shots that we got.
Yeah, that's going to be week 3 and week 4. No worries. All right, let's go back to routes. So we are now in the parental routes. Inhalation, do we want local or systemic? Asthma, where do we want it to work? If I'm giving you anesthesia, where do I want it to work? The whole body. General anesthesia. All right, to the skin. So what's stronger, ointment or cream? Ointment. Our skin absorbs what quicker than? The ointment. Ointments go through our skin quicker. No thank you. Urethral administration. If you have an infection, sometimes there'll be creams or inserts. And then for irrigation of the rectum, what do we call those solutions? Starts with an E. And then irrigation of the vaginal canal, that are douches. And there used to be a lot of commercials for it, but now you're not supposed to use it because it destroys your natural pH. So no more commercials of those women frolicking in the meadow and forest. Pediatrics. So a lot of times kids, they'll have specific dosing. Shh. I'm armed and dangerous. These are not just pens. This is heavy. Yeah. So anytime there's noise, I just have a reflex.
Make sure you aim straight and true.
I used to pitch and I did play quarterback as well, so it's all good. No. So Madden 95 does not count. No, Madden 95 does not count. But if you pick the Oakland Raiders one year, you kick butt in that Madden game.
That was on Super Techno Bowl.
Raider Nation.
All right, so for patients, pediatric patients, sometimes you have very precise dosing. So it won't fit your standard dram size, teaspoon size, or tablespoon size. So they'll give you a measuring device. OTC, do you need a prescription?
No.
What's BTC?
Behind the counter.
Do you need a prescription?
No.
Some say yes, some say no.
No.
Not all of it. What?
No.
All right, do you need a prescription? Yes or no?
No.
Behind the counter?
No.
What the hell? No.
No.
No. You do not need a prescription.
You just have to ask for it, right?
Yeah. You just have to get it from a pharmacist or a technician. That's it. So some reason is, well, they use it for
Drugs, recreational use.
yeah. So some are abused, some are dangerous. We just want to make sure it's used for legitimate reasons.
So they ask you your age?
They do, and I think they also track it.
Well, I know when you get to the register, it'll stop you from purchasing, and they have to come and put the information in the system.
Yeah, anything containing Sudafed, by law they have to collect the data. And for certain ingredients, they check ID as well, just to make sure. All right, we got to check drug-drug interaction. So 2 drugs together, 1 + 1 can equal 2, right? If you took 2 different drugs together, that's the effect. But sometimes you take 2 drugs together and it might magnify the effects. It might be 30 times as strong. Right? So just be careful. We might not know until patients take 2 different drugs together. Food-drug interaction. You're on statin drugs. What food should you not eat?
Grapefruit.
Grapefruit. Very good. So Lipitor and most of the statin drugs, it's going to interact. If you are on diuretics, do you eat a banana or don't eat a banana? Don't eat a banana? Do you lose potassium or do you spare potassium? So do you need a banana or you don't? The correct answer is, well, it depends on the type of diuretic, right? Because some are potassium sparing, some are potassium losing. So trick question. Just making sure you guys are paying attention. Adverse reaction. So during clinical trials, all the reported ones are listed in the drug monograph or the package insert. Where can you find a collection of package inserts? PDR. So if you ever want to know how to use a drug, just go to the PDR. That little piece of paper they fold up with every drug, it's all in there. It's all in the PDR. Most dangerous part, patient compliance. A lot of times patients start feeling better, and what do? So this is very dangerous for antibiotics sometimes, because which ones survive when you take antibiotics? The strong ones. So a lot of times you should complete your regimen so you eradicate them all, and then the strong ones don't come back. Alcohol affects a lot of medication, so avoid alcohol. Patients, that's going to be very difficult. All right, intramuscular injection. Which of the following describes IM?
Can administer a larger amount of medication?
Yeah, so relatively. Very nice. What is the gauge?
Inside diameter of needle?
Yeah, so that's going to be how thick the needle is. How about subcutaneous injection?
Provides a slow, sustained release.
Okay. Any other guesses? It's in the question. It's in the answer.
No, it's intradermal.
Which one is it?
Slow sustained.
Slow, sustained release. I know. Just making sure you're paying attention. Intradermal injection.
Used to administer skin tests.
What's a vial?
Small bottle with rubber diaphragm.
So make sure you spell it correctly. And then IV injection.
Provides an almost immediate effect.
Yeah, so absorption is pretty much 100% with IV injection. And then lastly, Z-Track. All right, paparazzi time. Very good. She's in the back, ready. Camera rolling. And then just post it in the discussion for everybody. No? All right, charting. All right, so you pulled the patient's chart already. You confirmed ID. So you do not have to document the patient's name and their date of birth because it's their chart. You just have to make sure it's the correct chart you're charting in. So give me one item you'll need to document.
Time.
Yeah. Time. Date. What else?
Location.
Medication. Location.
Allergies.
Allergies.
Lot number.
Lot number. Allergies? Do we list the allergies? So we give the drug, Do we chart the allergies? The reaction, yeah. The allergies should already be in there. We should already ask. Results, reason. How about consent? Yeah, so we'll be doing consents starting in week 3 for IM. How about errors? How do you correct errors?
One line initial.
So any gaps, you're supposed to clear them out. But for us, 2 lines, just try to fill your charting in those 2 lines. And then once you fill out your charting, what's the initial for? Bernadette, what's the initials for?
TCT.
Yeah.
TCT, right?
Just for somebody to double check, yeah. So yeah, that's just checking your documentation. So you can have another classmate. Abbreviations and symbols. So make sure which ones are not allowed. And
so
for
do they post that?
What's that?
Does every facility post what they use and what are not used? Because I know for us, we had a list of abbreviations that we couldn't use, and but then when you went somewhere else, they used that abbreviation. So is it same on that side?
There's going to be universal abbreviations that should not be used. So those are the ones you should learn because those are going to be the same from setting to setting. And then from the FDA, you can get the list from the FDA. Just find it off their website. And then for your facility, they're going to use their own approved abbreviations and symbols list. So make sure you know which are which and which setting you're working at. So for example, microgram. How do we write microgram? So the Greek letter mu should not be used. What is TIW?
3 times a week.
Commonly mistaken for twice a week. What is QOD? What does it look like?
Right now?
QID. So you can't use QOD. So there's going to be a whole list of them. Here's another one. What is this symbol? Or 0, right? Depending on how messy you write it. How about numbers? Can I do 0.5?
No.
So I have to have a 0 for it. So these are going to be some of the standard abbreviations you should be familiar with.
Wouldn't a lot of this be like eradicated if they actually wrote legibly?
Yeah, but to prevent errors, we're not going to use them. Even if you write numbers legibly, without the 0 in front of the decimal, it may or may not transfer.
So most people put this in the computer now anyways, right?
90%.
Done computerized anyways.
Yeah, 90% will be physician order entry. But when you're working in a high-paced environment, smaller facilities, it's still going to be pen and pad.
Okay.
What should you instruct the patient about regarding drug administration? So this is open-ended.
How they take the medication, meaning how often?
Yeah, so it's everything. So let's see. So read the label. Look out for drug-food interaction. So remember, this is an MA task, not a pharmacy technician task. So a pharmacy technician cannot do this because it's part of counseling. But an MA, this is part of patient education. So you got to recall the scope of practice. So they call this class Pharm 107, but it should be MA 107 because it's a drug administration for MAs, not technicians. Technicians don't inject. When charting, you gave the patient a subcutaneous injection. You wrote intravenous by mistake. What should you do?
Draw a line through it, initial.
And more importantly, you might have to put the reason. Right? So to cover your own butt, make sure you put the reason after any changes you've made. Not too bad, moving right along. All right, that brings us to the end of 2. All right, so let's see. That side of the table, or that side of the room, east side of the room. We'll have you guys set up the lab for us today. So please go over next door, set up the lab. put the tables together, and then put on the paper. Thank you.